How this exercise kills erectile dysfunction. Erectile dysfunction can be caused by a bunch of health stuff like heart disease, diabetes, high blood pressure, clogged arteries, kidney problems, multiple sclerosis, and injuries around the penis that mess with blood flow or nerves. Bad habits like smoking, not exercising, or drinking too much booze can make those health issues worse and make ED bad too. A lot of those things come from an unhealthy lifestyle. So getting more exercise on the regular can help avoid them and maybe make ED less of an issue. Many benefits of exercise are indirectly linked to better erections and sexual function. For instance, since regular exercise increases your physical endurance, it could improve your sexual performance by giving you extra stamina. See, working out improves stamina and endurance. So if you're getting busy with your honey, having better physical fitness means you won't poop out as fast. Nice, right? Anyways, there was this one study that had dudes with high blood pressure and heart problems and stuff start exercising more. We're talking getting moving for at least 160 minutes every week for 6 months. And guess what? Those randos started reporting improvement in their bedroom woes. The guys getting busy on the regular said their little buddies were getting more cooperative. So yeah, seems like making time for exercise can totally help with erectile issues. The more time you spend working out, especially stuff that strengthens your downstairs mix-up muscles, the more likely you'll be shooting at full mast. Work it out, get it up. The 3 best erectile dysfunction exercises for improving ED are 1. Pelvic floor exercises. Let's start with the most apparent and proximal regimen for the issue itself. The finest preparation for erectile dysfunction entails directly targeting erectile operation, and no workouts better target erectile fitness than those controlling your erections. Floor muscle exercises, known as Kegels, build the muscles encircling the penis. In one examination posted in the urology publication BJU International, academics inspected the impacts of floor muscle training on erectile well-being in males with long-haul erectile brokenness. Individuals were separated into 2 groups. Both were coordinated to make lifestyle adjustments. However, one gathering was told to likewise do floor muscle works out and following 3 months. The men who did floor muscle exercises and made lifestyle changes had a fundamentally higher pace of recuperation from ED than members in the control bunch. This infers that floor muscle works out could be a compelling treatment for ED. More current examinations have discovered that men influenced by ED will in general have more vulnerable floor muscles than their partners, proposing that floor muscle capacity is involved in erections and sexual capacity. It may even assistance with untimely discharge. 2. Aerobic exercise for ED. Scientific research shows that any type of exercise improving cardiovascular health may also boost erection quality and sex drive. For instance, a 2011 meta-analysis strongly linked aerobic workouts with better erections for guys having arteriogenic erectile dysfunction, ED from poor arterial blood flow. Even a quick daily cardio session can start addressing issues like obesity, hypertension, and cardiovascular disease risk factor. One basic way to hit this goal is allotting 30 minutes for exercise 5 days weekly, and besides cardio attempt, at least 2 muscle training sessions weekly, whether at the gym, yoga class, or home using body weight. Since sturdy erections depend on blood flow, any exercise benefiting cardiovascular health may also lower erectile dysfunction risk. Aim for 150 minutes weekly of moderate aerobic activity through brisk neighborhood walks, treadmill walking and jogging at home or gym, outdoor or stationary biking, tennis, basketball, boxing, lap swimming, or water aerobics and yoga. Try different activities, mix it up, or just do what feels best. Most importantly, move your body. 3. Pilates exercises for ED. Turns out Pilates could actually be a pretty good, specific workout for helping with erectile function. Studies have shown it can help people having issues with their pelvic floor, like women dealing with leaking after giving birth. The moves work the same muscles guys need for erections. There's no research actually connecting Pilates to boner improvement specifically, but it activates the right muscles down there, which are key for getting hard and staying hard. And a few Pilates moves to try. Knee drops. Lie flat on your back with feet on the floor, knees bent. Squeeze your pelvic muscles while slowly lowering one knee to the side towards the floor. Go as far as you can, then back to center while squeezing. Do the other side. 5 on each. Leg lifts. Lie flat on your back with feet on the floor, knees bent. Lift one leg up, keeping it at a 45-degree angle while contracting your pelvic muscles. Hold 5 seconds, then lower slowly. Switch legs. 5 each side. Does exercise help with erectile dysfunction? Dealing with erectile dysfunction can be tough. Basically, it means you have trouble getting or keeping a firm enough boner to have sex, and which, as you probably guessed, has to do with overall health and stuff. Getting hard is all about blood flow down there. When you're turned on, your nerves tell your penis to send more blood to the spongy tissue inside. More blood makes it bigger and stiffer, but there's a lot that can mess up the process and cause issues with getting it up, or at least contribute to it being a problem. From physical stuff to mental health and stress too. Even your diet and bad habits sometimes. So if you can't rise to the occasion or stay standing at attention long enough when it counts, don't just brush it off. Could be a sign something's off. Probably worth talking to your doctor and figuring out what's up. No shame in needing a little help in the bedroom either. When it comes to dealing with erectile dysfunction, ED, most people think of medications like Viagra or talking to a therapist. But there's another option that doesn't get as much attention, even though it can be just as helpful. ED exercises. Just like you can work out and strengthen muscles in the rest of your body, you can also target the pelvic floor muscles near the penis. Exercising these muscles with specific regimens can go a long way toward improving erections and sexual functioning over time. The key is being consistent with recommended exercise techniques so you reap the benefits, and some men may feel funny about doing pelvic floor workouts, but they should think of it like any other form of physical therapy. The exercises are meant to help specific muscles related to sexual performance. Maintaining a regular routine can restore strength and confidence on a very intimate level. There's other things that can help with ED too, not just working out. Doing pelvic floor exercises and just moving more in general can get blood flowing better down there, which helps boners happen like they should. But that doesn't always work for every guy. And meds and other lifestyle stuff can help too, in addition to exercising more. Erectile dysfunction can certainly put a damper on one's love life. If healthy lifestyle changes like exercise don't do the trick, medications may help get things going in the bedroom again. The oral drugs sildenafil, tadalafil, and alvanafil can be popped shortly before getting frisky, offering a boost when needed. And Hims even has chewable mint-flavored versions for convenience. Of course, it's wise to educate yourself before trying any new medication. Understanding how ED meds work and potential side effects is key for using them effectively and safely. While the drugs aim to pave the way for passion, it's still important to feel fully comfortable with your partner. With some counsel from your healthcare provider, open communication, and the right tools, many find their intimacy issues resolved. Erectile dysfunction can definitely get better by making some lifestyle tweaks. Getting regular exercise helps blood flow and all, but it's not the only thing that matters. Just eating healthier in general, more balanced meals full of good nutrients instead of junk, seems to help many guys be able to get and maintain solid erections. Oh, and lay off the booze if you tend to overdo it. Drinking too much doesn't do any favors for the old wood. Quitting smoking is another biggie when it comes to improving blood circulation everywhere, including the fellas down under. And there's actually a bunch of small things you can try changing up that might make getting hard easier. Our little guide talks about some other not medication tricks that could give your sex life a boost if ED is an issue. Now, dealing with men's health stuff and keeping your junk in good working order definitely gets confusing real fast. Heck, trying to understand how Kegels and pelvic muscles even work is enough to make your head spin. But don't freak out. Pretty much every dude feels totally lost when it comes to this kind of thing at some point. Here's the key takeaway on exercise for erectile dysfunction. While medication tends to be the go-to initial treatment, research indicates that physical activity could also help enhance sexual function and performance. Studies largely confirm that certain workouts, especially pelvic floor exercises and cardio, can benefit erectile health in men. Vigorous cardio training potentially promotes weight loss, better cardiovascular health, and reductions in contributing factors. Kegels specifically target muscles that regulate blood flow tied to erections, strengthening those groups for improved firmness. So for guys struggling with ED, well-targeted exercise offers a constructive, non-invasive approach alongside seeing a doctor about medical solutions. Ultimately, both routes have merit and could work in tandem, but lifestyle adjustments like fitness deserve consideration before jumping to prescription options.